Hi, everyone. I'm Laurie Buis. Thank you for that wonderful introduction, Kathy. And, I think Kathy said a lot about who I am already, but I just want to say that I've been working in this space for about 15 years and with internet-mediated interventions even before that, so about 15 years in mobile health. And through my role with JMIR, M Health, and U Health, I really have the luxury and the privilege of looking at the field from a 30,000-foot view and thinking about how do we develop as a field and what are the concerns and how do we move things forward. And so I think that's a really nice position to be able to think about what it is we do. In terms of my own research, I have had a lot of experience starting all the way back, like I said, with internet-mediated interventions, but then moving into text messaging and mobile apps and wearables and integrated peripheral devices. Like, I don't know, I don't do the sophisticated data stuff that Pedja does, but I've really come to learn a lot about how do we work in this space and how do we think about the teams that we have and that we assemble. And in doing so, most of my work is focused on blood pressure self-monitoring, and I've done some work in cancer prevention, and now we're moving into reproductive health. There's a lot of really interesting things, but the team really comes back to having the right people. And when I think about the right people, the two talking points I want to really start out with is right expertise, because there's so many things that we need to think about beyond just how do we run a research study. The concerns that we have about regulatory issues and troubleshooting and technical issues, what we require in our coordinators and our support staff is really different in a mobile health world. And the credentials that we need people to have and the training that they need to have is really a little different than in a lot of the other work that I did before I came to this space. So I'm hoping we can have a nice conversation about that in terms of, again, technical expertise needed on staff, thinking through information architecture, data flows, also the clinical staff that we need to have and the clinical expertise, just a wide diversity of people needed to bring these studies to fruition. But also, there's a lot to think about in terms of the team, in terms of development. So I've had experience, like many of the people up here, working on both homegrown systems and working with third-party developers, because there's a lot of different concerns for both of those setups. And there's pros and cons to each, and I hope we can get into some of that today. So I'm excited to be here on this panel. Thank you.
Yeah, thanks for having me. I'll probably start with there's obviously more than one way to skin a cat. And so when thinking about building a team in the area of digital health or M Health, you can do it many different ways. And it really ultimately, I think, comes down to what it is from a research perspective that you're going to do. So I'll start a little bit about what I do and how we built our team, just to give you a sense. And so we do a lot of just-in-time adaptive interventions, which requires a lot of customization. And so there's a lot of technical work. So what Laurie mentioned about, depends on the level of technical abilities that you need. And so we build a lot of homegrown systems, either web apps or mobile apps. So for me, my team, I need people that can do that work, because finding a system that you can just pay a monthly fee for and have a lot of the customization that we need is hard to do. And so no matter what those people say, so if you go to their websites and they say they do JEDIs, they don't necessarily always do just-in-time adaptive interventions. So for my team, I needed technical expertise, and we've grown our technical team to have 2 developers to help with that. The other thing, the feedback that I've gotten from mentors and actually granting agencies when we've submitted grants, is having a project manager is invaluable to help keep things going, whether that's on the technical side, keeping development going, or on the clinical side of keeping the studies going and keeping everybody on track. So from a team perspective, those were my first 2 requirements. When I started building my team, was a technical person, at least one, and a project manager to kind of help keep everything going. Because as a researcher, you can't keep up with everything. And then over time, we've expanded. So like I said, we added another developer because of a lot of the projects we had going on. We needed more technical expertise and development. And then we added a research assistant just to kind of keep things going like REDCap and other systems. So over time, we've grown that. And the other thing I'll say is we do a lot of clinical trials, is that doing clinical trials is a whole nother part, right? It's almost like a separate team to keep track of all the regulatory things, IRB, and appropriate screening and consenting and enrolling patients in clinical trials. So that's another thing to think about, is like, where can you get that expertise? So like in my group, we actually have a center that we work with that has most of our recruiters. In fact, they're sitting over there, that do a lot of our recruitment for our clinical trials. And so I think those are important positions as well.
Great, thanks. Oh, it's on? It's on? Okay, thanks. Yeah, it's really great to hear your experience with these. And I think the balance between what to do in-house and what to sort of outsource is something we think about a lot, and there's no right answer. It depends on the project, and probably a balance of both works best. For the intern health study, we've been collecting mobile data about 10 years now, and Elena talked about this in the future proofing session, but essentially it's we're on an annual life cycle. So each year we enroll a new cohort of a couple thousand subjects, and then have a period after that to update, improve, or change our mobile data collection and intervention plans. And it's evolved in lots of different directions. So it's gotten pretty complicated. I think the general approach that we've had is to have a small core group of people, mostly sitting at that table, who, none of our primary jobs is sort of technical mobile technology, but we're all expert in something else and dedicated to the project, and able to decide what works best. Elena went through a lot of the rigorous, sometimes ridiculously rigorous testing we put through our sort of partners that we work with. And we've gone through lots of different partners, both in terms of app development and pulling in different components. And especially in this world that's moving so quickly, it's good to have, be able to work with people who are expert in their own specific domain and can keep up with things, but then still to test it and to have a group that can really figure out what works best and what doesn't. And the other thing we've tried to take advantage of is that, again, there's so much going on and so much exciting things going on, and a lot of it here at Michigan, and hopefully the Mobile Technology Core and things like MeTRIC can help us all stay up to date on what's going on, and again, figure out who's doing things really well, and then try to partner with them to make our project as good as possible. So trying to find the right hybrid between having a group internally that can centrally make decisions, but not have to be expert at every component, and particularly in things we're not trying to, we're not planning to write a methods paper on. Then just trying to use whatever's best out there, and then finding the place where we're gonna really innovate and focusing on that and bring some of that more in house. So, but it's great to hear what different teams are doing, and hopefully we can borrow from each other. So, thanks. And I think, are we open to questions now? So yeah, so we'd love to discuss amongst ourselves, but have questions on how we think about teams, and if you guys have other thoughts or approaches, we'd love to hear and discuss that as well.
I'll kick it off. Okay. What is either the most detrimental choice that you've made or biggest oversight when it's come to forming your team for a mobile tech study? Basically, like the biggest screw up you've had.
Rima? Just no, not that she was the screw up. She's the one who knows the answer. No, but I jest.
I mean, I don't know if I have a specific one, but maybe a global one is, I was very naive at first, thinking that, we could build something that was as good as the tech industry could build. I mean, that was something that I learned very quickly is like, there's multiple grades of digital technologies, right? There's probably the Apple, Google, Meta type grade, right? That you have on your phone. And then there's, probably I'm trying to think of a good company, like a company that is probably not a $1 trillion company, but a sizable company that has an app on your phone, right? And then there's research grade, right, which is kind of what we do. And then there's maybe, I don't know the crowd well enough, but master's or Ph.D. level grade, right, apps. And so level setting your understanding of and there's maybe more grades than that, but those are the 4 in my head, that you're going to be research grade. You're going to be probably right 99% of the time, but if you enroll 100 patients in a study, you're going to screw up, right? And the more patients you enroll, the more people you're going to screw up. And so you have to realize that and know that there are limitations of being research grade if you're building your own apps, and you have to build in a system to check for that and figure out what those issues are and know that they're there and not get too frustrated when you're not doing what Apple or Meta or Google is doing.
And the one thing I'll add to Mike's point is that when you're setting up a budget, and you're like, oh, it's going to be really cheap to hire some master's students to do something. Yeah, it initially is. But there are cost implications with doing things a certain way in terms of homegrown systems that people don't think about in terms of cost. Ongoing maintenance, ongoing bug fixes, ongoing security. When your student doesn't pan out and you have to hire a different student who has to rewrite the code of the first student, like it can just domino and domino. And that's something that when I started my career doing homegrown systems, I was like, oh, eGads, never again. And then I started working with third-party vendors to develop things. And they come with their own host of challenges. And then now we're like, wait a minute, let's look at the budget. Let's look at what we're trying to accomplish. And let's see the right thing for the right project. Because now I would say we have a mix of what we do in terms of homegrown systems and not. And neither's perfect. The grass is always greener, and I assure you, there's no green grass anywhere.
That's generally true. I think we've probably migrated more from the master's level up to, I guess, wherever we could get away with it to use the more Google Meta level things, because there's no way we can invest as much into making them that user friendly, that secure and reliable. But then when we need to go down, but not letting, I think in everyone's mind, especially when they're developing an app, they have, these 80 specific specifications, and if a professional one only has 79 of them, then trying to build your own. And I think we've tried to move away from that and not letting the perfect be the enemy of the good, and use whatever's best out there and adapt unless absolutely necessary.
Can you use the mic?
Oh, use the mic, sorry.
Just behind you.
I'm curious if any of you have advice for people who are just starting out. So I'm trained as a methodologist and haven't collected data since undergrad, but have gotten some pilot data and have a K award under review, both of which are very small budgets. So curious if you have any advice for people who are starting off and working with small budgets.
I think a lot really depends on what it is you're trying to do. There are a host of low-cost, free-to-research tools out there that you can use to simulate a lot of neat mobile experiences. But like if you're trying to do something along the lines of like what Pedge is doing or what Mike's doing, that ain't going to cut it. So, I mean, it really depends on what the project is. But I think there are more and more low cost and free tools that are out there for certain types of mobile experiences that are really interesting and unique and can do a lot of really powerful things. But again, it really depends on what it is you're trying to do.
Yeah, I would just say like someone just had the same question. I got an email like Monday with the same exact question. And like the first thing I always tell people is like REDCap. Like REDCap's a pretty good tool. It's free. There's a lot of things you can do in it, like conditional logic, if-then statements, like a lot of stuff you can do within a survey tool that can be, you know, on someone's phone or other stuff. It just depends on what you're trying to collect, right? Like if you're getting sensor data and other stuff. But if it's more simple, like starting with REDCap is a nice way.
Yeah, I think that those are all great ideas, and REDCap's really good. I think come talk to the Mobile Technology Core to talk about it more in depth, and if it's at all possible, piggybacking on a larger existing study, you can always get just so much more done. And again, it might not be perfect, but if it's close enough, then you can really do things at a scale that's really hard to do on a K budget.
One issue about the team that I'll bring up that I think is really important, as somebody who does a lot of grant reading and grant reviews and sitting on a lot of review panels in the space of mobile health, it is really important to identify people on your team as at the grant writing stage. And I cannot tell you the number of grants that I have seen tank in review because key personnel were left TBD in the budget justification, because anybody who's worked in this space long enough knows that this work is hard. And it's not hard because it's conceptually hard or that it's technically hard. It's that when you're working with a third-party developer, there's a lot of challenges. When you're working with an in-house developer, there's a lot of challenges. And if you can't demonstrate that you've seen these challenges and worked through these challenges and have a team that has experience working through these challenges, you will not make it out of a review panel. And when you write letters or when your letters come in of support from your vendors, if they're not specific that talk about what your vendor's going to do for you and how they're going to support your project, or you have no evidence of working with somebody, whether it's an internal person or an external person, it's going to tank in review. So having TBD on a budget justification for really critical roles on your team, it's like a death knell. It does not do well in review. And you know, one of the strategies we use, like I laugh because Rima, you've met Rima a couple times today. She's been on our teams for many, many years, and whether she's going to work on a project or not, she'll have some capacity on the project for sure, some role. But we use her as a placeholder because she has a lot of experience and a lot of expertise. And rather than saying that she's, you know, a TBD, or that role would be a TBD program manager, we use her credentials and say, Rima's involved in this and she's got 15 years of experience doing this. And that looks a lot better in review, for sure.
Yeah, I'll second that too, and that maybe that's one of the groups we didn't talk about from a team perspective is the collaborative team as well. Like, you know, if you're not a clinical trialist, but you're more in the technical space, having a clinical trialist that is someone that, you know, knows that world, having to be a collaborator on the grant and have their name on the grant, obviously is important. And then you can sort of like fill out all the other people, like I work with Pedja and Walter and those people that have that expertise that I don't have. So filling out your sort of scientific team, maybe that's a little easier, and maybe that's why we didn't mention it at first. It's easier to find your scientific collaborators that build your team. in addition to that. So I think that's another important one. And we've done the same thing, whereas, my project manager will be on all of the grants that go in, but she may not be ultimately giving all of the effort that was on that. So like not having that TBD is extremely important.
Yeah, I think that makes a lot of sense. As much as you can for grant purposes, having preliminary data that demonstrates you can do it, even if it's a little bit removed from the aims of the project. And then for all these, for the Mobile Technology Corps, for D3C, for others, having the sort of boilerplate language about how they advance mobile technology in your project is relatively easy to do and should be a part of all our grants for this.
And if you're not putting MeTRIC on your environment and resources, you're doing it wrong. Because like that is an important resource, even if you're not using the group. The fact that this group exists on this campus is an important part of environment and goes to showing the feasibility of you being able to complete the work that you're trying to do. And thinking about, to the question about, I'm just getting started and I'm on a K or I'm a junior faculty, how do I get established? Find somebody in this room who will partner with you to make sure that you know the pitfalls you're about to step into. Because again, it all goes back to demonstrating feasibility of doing the work you want to do. And without demonstrating that feasibility in your grant applications, it's just not going to go very far.
I actually have a question. So I'm going to take a leap here and say none of you are IT experts. So having that be true, how did you approach determining what technical skills you needed and like figuring out how to write that job description and find those right people?
Yeah, I mean, while I'm not an IT person, like I knew enough about what I needed that it wasn't too hard. Maybe I didn't know that there was a difference between a front-end developer and a back-end developer and a full-stack developer. Like I didn't know that terminology existed, but I knew I needed someone that could, do all of those things and be involved in, creating a database, creating a front-end that interacted with the database, all that kind of stuff. So it wasn't too hard. And then also like talking to other people, right? Like when I wrote my initial job description for my first developer, like I went to some of our IT people, right, in our college and in other places and said, what do you think of this? Like, does this even make sense? Would someone even submit an application, to this job? So talking to other people that are in that space to figure out, what kind of fits right for the job description.
Yeah, and I think trying to find examples of the person you want who's already here on some other team and basing it on that. And then I think not trying to get too exact, like what they're going to be doing the week after you hire them is really different than what they're going to be doing a year from now. And so trying to get people who are just smart and flexible rather than like for the specific, because you're not going to know how things are going to change, and trying to be too specific can get you into trouble.
And I think the only thing I'll add is that I find that people who work in the mobile health space, you have to get good at figuring things out that you're not comfortable with. It's such a multidisciplinary world. And like, I'm not a clinician. I'm not an IT expert. Like my background is in information science and I don't code. I don't do, so like being very comfortable in saying to people, I don't know what the hell I'm doing. Help me. And people are pretty generous to give you a little bit of time to help you. They're not going to do it for you, but being comfortable at knowing what you know and knowing what you don't know, or finding people who can help point out what you don't know so that you can fill in those gaps. Like there's a lot of humbleness, I think, that comes with working in such a multidisciplinary space.
And I'll just add a comment. So probably one of the biggest surprises that we had with the Mobile Technologies Corps and looking for resources and connecting investigators with resources is how spectacularly helpful HITS is. Believe it, HITS has been such a huge resource, and they offer just a huge amount of resources so that really, especially if you're an early investigator, can help get projects off the ground, or at minimum show you where you've left people out that you're going to need in the process of getting your data from the wearable to the hands of your analyst.
So we're talking about team members. I wonder if there are community-based organizations, or are there members in the state infrastructure in the state of Michigan that are also have a vested interest in public health that may also be interested in partnering with any of these projects? Is that a viable option? Have they expressed interest? Or I'm thinking of like the Michigan Department of Health and Human Services, who has a lot of interest in community health, but also health. Do they ever partner with members here or reach out, or getting a lot of?
Not to my knowledge.
I will say that I've had better experience though. Like I haven't had any experience working with MDHHS, but I've had a lot more interest working with payers. Not that I've worked with payers, but I've had a lot of conversations with payers, because I think many of us in this room know that implementing things within Michigan medicine is kind of a challenge. But when you talk with people like Blue Cross, they have the ability to do things in a way that our health system is not willing to try. And we've not mobilized anything in this space, but I've had a lot of conversations with a lot of interest about how we could leverage payers to get more accomplished, because they have more leeway to do things.
They also are increasingly incentivized for helping their members engage in care. I'm familiar with cash incentives to payers in the sickle cell realm, for example, paying the plans for their members engaging in health. And I wonder if there's a way we could leverage some of that leverage on them, perhaps, to partner with us or engage with us. So just a thought.
And I think there's more potential in the clinical realm of things that are proven to be helpful, that hopefully we're starting to get to, rather than the research realm, but potential partnerships in both.
One last question. How does having the mobile technologies within your research impact your budget in relation to team? And I know, Laurie, you and I have had a conversation about that. And so, yeah, how does it, and how do you plan for that?
It's an excellent question. And it's something that I think when you're putting together a budget, you have to think a lot about. And there's a lot of different pieces about it, because it's not just all of the expertise you need and that you need to pay for, but like when you're working with a third-party vendor, that adds like this additional complexity in terms of cost. Because when you apply for a grant to NCI and you get funded, but you get funded with a 17% reduction, that 17% is not going to come out of your vendor's budget, because they've already made enormous compromises in what they would normally charge if you're getting a research rate. So now you're thinking about, how do I bear a 17% reduction when I have an enormous cost that is fixed and I cannot touch it and move it? If you're lucky, your vendor will work with you, but if you're not, you're not. And you also have to think about it from, even if I can take a 17% reduction and I'm building it in a house, you still have to have a minimum viable product that is going to cost you a certain dollar amount, and you can't undercut paying your students or your developers. There is still a somewhat fixed cost to developing what you need to develop. And maybe you can cut a component or a feature or some other way to reduce costs, but it makes it very difficult in a budgeting environment in this research climate to move forward. It's expensive. And when we talk about having the right expertise, having study staff who has the technical expertise and the regulatory knowledge, like this is not your $35,000 a year coordinator who's entry level just starting out. It's not. So like it gets expensive quickly. And so to that point, it's hard this is a tough space to get started in on your own. And come talk to people like us who've done it many times, because we've got tips and tricks, but it's tough. It really is.
Yeah, and I don't know, I feel like maybe it's because of what I've chosen to do, that having like developers is a little bit easier when there's changes in funding, than the situation of you hired a company and a company's they're not going to take their 17% cut, right? So, it's a little bit easier to absorb my R1 got a 20% cut. So like, it's basically they take away a year, right, of your R1. So it's, it's a little bit easier when you have a developer that is already on staff that, maybe have another grant that's paying for part of them, that, that's easier than saying, well, we have to cut from everybody else's budget and still give this external developer their 100% that they asked for.
Another thing I'll add is don't undercut your budget. As you're building your grant, understand there's a really good chance you're going to take some kind of cut. If you're lucky, it's a small one. If you're not lucky, it's a big one. And I know with our program officers at NHLBI, we've been recently encouraged. We try to keep our cap under the $499,000 a year. And they're saying, don't do it. If it's going to compromise the budget, don't do it. Apply early for the waiver to apply over that dollar amount, because it shows feasibility. And if you're going in with an infeasible budget, people like us know it, and we see it in your budget justification. And again, it undermines your feasibility and it will undermine your score. So don't do it. Don't think I'm going to write this real cheap just because I want to get it funded, because all you're doing is sabotaging yourself and your science.
Yeah, I think all that's true. And I think in budgeting these grants also, again, try to stay flexible. And for most NIH grants, like you don't really have to stick with what you said, as long as you're staying within the spirit of the project. And in this space, trying to predict what you should spend your 2029 budget on in 2024 is ridiculous, and it's going to change. So so being open to being flexible with your apps and devices and even what is the most exciting hypotheses. And I think that plays into the budget being more of a vague sense of what you're going to spend the money on, especially in the out years, than in the beginning. But different people have different philosophies on this, but I tend to be that especially in fast moving areas like this, that we should adapt quickly and at a faster pace than the NIH general timeline and approach.
All right, I'm going to let people think of one last question. Now's the time to ask it. You have literally the A team up here, but this is more of a curiosity than anything, but given that academics is maybe not the most lucrative place to live, have you guys had issues with turnover for your technical staff members, or has that not really been a problem?
For me, that hasn't been a problem. And I don't know why, because I can see that, it's a lot. You can go work for a company in Ann Arbor, right? Make a lot more money than what my developers make, right? And so, I don't know. Sometimes it's the, working in the academic environment's a little bit better, right? People can work remote. There's other benefits that Michigan has that other people don't have. That the maze handcuffs or whatever you want to call them about the 2-to-1 match and other things. Definitely more flexible. I think for me, I don't know about you guys and your staff. I'm really flexible with my staff, like very flexible their work environment. So maybe that's part of it too, is that we're way more flexible than if they were working for a local software developing company in Ann Arbor that would be very regimented about what they do. There's some things I have heard. I've never been in a software company, but there's much more stress doing software development in a software development company than there is maybe here. That could be an added advantage.
And I would say we haven't really had any problems beyond what any research study would have, whether it's in the mobile health space or not. I mean, working in the academic medical center is kind of a weird spot to be in, or like in a university, because we have this preponderance of people who are looking for 2 years of experience before they move on to the next part of their career. And that's, I think, something we all struggle with, regardless of what field you're in within the university. But we've had really good stability on our teams, just like you have, Mike. And I like to think it's because we don't suck, but I think there's a lot of reasons why people like to be in this environment as well.
Yeah, and I think when we first started and were working with app development teams within the university, that was a problem that whoever was working on our project would leave for a local company a few times. So for a lot of that, we are now just working with the local companies. But for key components of the project, our in-house team is there and stable. But I think there's certain jobs that really are pay so much more outside that finding the balance on which components to do in-house and which with an external partner is important, and that's part of that decision making.
And one thing I'll add to that is if you're working with internal people, it can be really helpful to ensure that you have somebody on your team who's responsible for overseeing that part of development. And when I mean someone responsible, I mean someone who's not somebody who's going to leave on you in a year or two, like having a faculty member who has a pipeline of students or postdocs, or somebody who works in IT within the university who has a pipeline to keep. So if you do have turnover, they can help backfill easily and quickly and know what they need to backfill with. That helps quite a bit. But if you're doing your own hiring and then you have to be the expert who backfills, that can be a lot more challenging to have to operate.
Great job, you guys. Thank you. So just to recap, add REMA to all your grants. Okay, perfect, good.